In July of this year, the Minister of Health, Dr. Frank Anthony's position on sending patient samples to the Caribbean Public Health Agency in Trinidad and Tobago to undergo genetic sequencing, a procedure to determine whether or not a Delta variant was present in Guyana at the time, was that there was no need to. He said health authorities were being guided by an assumption that the variant was responsible for the upsurge in new infections, hospitalizations, and COVID-19 related deaths.
Sending those samples for sequencing, it doesn't make much difference in terms of the way that we are treating patients. Treatment options remain the same, and we have to assume that we have those variants circulating.
However, for the first time when pressed by this newscast on Wednesday on the sidelines of World AIDS Day launch, the minister announced that 50 additional samples were eventually sent to CARFA for testing, and it was determined that the Delta variant had been active in Guyana. According to him, in the midst of the rapid increase in COVID-19 fatalities and new infections, health authorities took the decision to access testing at CARFA.
We had some samples that were sent to CARFA, and at the time when we were having a surge with Delta cases, and it confirmed what we saw clinically.
Dr. Anthony could not, however, provide a definitive date when the samples were sent. The Delta surge lasted several weeks and began to show a decline in early November. Genetic sequencing is a specialized laboratory technique done to identify new variants of the coronavirus. It is a procedure that is not being done in Guyana currently due to the lack of laboratory capacity. Consequently, the Ministry of Health had established partnerships to facilitate testing for the variants with CARFA, the Pan American Health Organization, and the Icahn School of Medicine. Dr. Anthony stated that the partnership with CARFA and the Pan American Health Organization still exists. However, the agreement with the Icahn School of Medicine had faded due to some issues. In January of this year, Nightly News broke the story of the possibility of a new COVID-19 variant in Guyana after a private laboratory had indicated same. Following that disclosure, Health Minister Dr. Frank Anthony noted later in the same month that approximately 10 samples were sent to CARFA, but all came back negative for the new strain. Since then, there was radio silence from the minister, and on Wednesday morning, the grand delay announcement that 50 samples were actually sent overseas, and which confirmed the presence of the Delta variant in Guyana. Temika Rodney reporting for the HGP Nightly News.